All right, next we have Dr. David Levy presenting today. You guys all know Dr. Levy, I'm sure, but I'll do a formal introduction anyhow. Dr. Levy is an economist. He got his degree from UCLA a few years ago, just many years ago, and he's currently a professor of oncology at Georgetown University. He is currently a principal investigator of the CAsToR site, and he is the PI of Project One in the center. He's also a collaborator on the ITC project and a major part of the CISNET lung group, among other things. Dr. Levy oversees the design and implementation of the smoke tobacco policy simulation model. He's going to talk about issues of menthol ban and lessons learned from that for modeling flavoring restrictions and ends. So take it away, David, when you're ready.
Thank you, Ritesh, and thank you especially for that comment. Just a couple years ago, got his PhD. And I'll be talking about modeling today, but unlike usual, I won't be talking about the SimSmoke model. I'll be talking about a different model. Let's see. Oh, here we go. So, you know, as David Mendez described so well, you know, modeling had been done to help with the idea of a menthol ban. This was an idea proposed 10 years ago. His work, my work were, you know, quite consistent. And there was also quite a bit of empirical work which indicated that a menthol ban could have major public health consequences. Nevertheless, you know, a menthol ban was proposed and was ultimately shot down by the courts due to lack of evidence. So back to the drawing board. And as part of our TCORs, we, in response to requests for modeling, we decided we would model a menthol ban. And in doing that, you know, the idea was, okay, we've done this before. Anything different need to be done? And we said, well, it looks like we're going to have to take into account e-cigarettes. You know, just no avoiding that these days. So we began, and the first thing we did was we did a review of the literature. And what we found out was there was really good evidence that a menthol ban would lead to cessation of smokers. What wasn't so clear, however, was the effect on initiation. And what I mean by that, it's not that there isn't evidence that menthol is associated with smoking initiation. There is, clearly, there's strong evidence. But the question was, what impact would there be of a ban? So we, with that, we decided, well, try to come up with estimates of that. And in doing that, we first had to think about exactly what is meant by a ban. It's always very important that the precise regulation or policy is well specified. And are we just talking about a menthol ban on cigarettes? Does it apply to cigars? Does it even apply to e-cigarettes? We decided that we would limit to a menthol ban applied not only to cigarettes, but also to cigars, because there was a strong literature out there of the closeness of substitutes, particularly between smokers and those using little cigars. So with that in mind, we wanted to construct our expert elicitation. And I must say that expert elicitation, it's a great idea. And it sounds like, okay, you just ask a bunch of questions. Well, it turns out it's not that easy. We spent really a lot of time developing the expert elicitation. I might even go so far as to say I learned more about how the modeling might be done in developing the expert elicitation than anything else. So we came up with this expert elicitation. And, oops, sorry. and the results of which were just published in Nicotine and Tobacco Research. And we developed this as part of our T-course, working with Dr. Surkaya, who described about expert elicitations yesterday. And we really, there was a lot of discussion, and it was, as I said, it really was very informative. Based on that, we did put together a set of questions. The next step was to determine the experts. And we did that based on our literature review, but we also did a search of the literature, got H indexes. And based on that, those two criteria, we came up with a list of names. We again discussed them, and we developed a list of 11 experts. And in doing that, it was important that we get a group with diverse views. You know, to me, one of the most important things in doing modeling is recognizing that there is tremendous uncertainty. So it becomes very important to get the broad range of views in developing the parameters. So that was a focus of our in determining our list of experts. We did the expert elicitation in 2 rounds over the internet, and one of the questions had to do with initiation. You know, as I said, this was a key concern, and again, it was very important in how we set up the question. And what we ultimately decided on was to think of in terms of people who would initiate into smoking by the age of 24. Now, what happens when there's a ban? What do they do instead? And this is the decision tree that we used. Based on that, we got results. So here the status quo is people by the age of 24 are menthol smokers. And then next to that, you see, and this is for the total population, what they do instead. So the bottom line here is that 41% still smoke, almost 18% use e-cigarettes, and almost 40% instead use e-cigarettes. So e-cigarettes did play an important role. Now, we also, you know, even though we had estimates for cessation, we wanted to develop those in the context of a model. So again, we wanted to look at the alternatives. Now, in doing this, what we did was first ask, well, what kind of transitions would people make in 2 years? Those who were menthol smokers, what kind of transitions would they make in 2 years in the absence of a ban? And then look at how that changes with a ban. So what you have here is the transitions without a ban. And we do see that a sizable portion quits. We got estimates of averaging 12.5%, and 10% switch to e-cigarettes. So how does that change with a ban? We look at the next column, which gives us what would happen if there were a ban to those smokers. And based on that, we look at the difference and we standardize that based on the percentage of menthol smokers in the status quo. And these gave us the transitions relevant to our model. So now we had the parameters. It was time to plug them into the model. I like working with the SimSmoke model, but I'll be the first to admit it's big and complex. And in doing this kind of modeling, in many ways, where we wanted to focus on a model that, you know, SimSmoke focuses on all the different policies, we wanted a much simpler model which focused on the relationship between e-cigarette and cigarette use. And starting out working with the ITC group and then working with our T-cores, we developed a SAVEN model, the model of which was just published. It should be in Population Health Metrics, just a couple months ago. And it's a model that tries to present a simplified approach, and it's a model that focuses on regular use. We've actually tried to validate that model. It validated pretty well, but you know, I can't emphasize enough that we're dealing with a period where there's potentially very complex interactions. And so, you know, people come down on one side or another on e-cigarettes, but, you know, I think we need to be very flexible until we get more and more information. So, but again, the focus here was on regular use. And what in trying to simplify, one of the decisions that was made was we would focus on transitions to regular use. So, for example, if somebody used e-cigarettes for a short period of time, became a smoker, ultimately what was important is that they became a regular smoker. And that's what we specifically model in SAVEM. We decided, and this is one of the more controversial areas, is we decided not to explicitly include dual cigarette users. They were incorporated with cigarette users. You know, we've gotten various reactions to that, but, you know, again, I would claim, and we want at this point to keep things as simple as possible. And until we understand more the interrelationships between dual use and ultimate regular use, best to avoid.
5 minutes, David.
Okay. So then we calibrated the model, and we calibrated it so that the trends in menthol versus non-menthol cigarette use seem to mirror recent past trends. And it took some adjustment to do that. And I would say the major adjustment was an initiation, you know, because we've seen such a drastic, really drastic reduction in smoking rates among youth and young adults. We had to come up with a way that our model incorporated that. So we did that. And based on that, you see here that the rates that we project for the future for both menthol and non-menthol smokers are probably lower than many of you would have would anticipate. But again, you know, it was important for us to capture recent trends. And in so doing, because cigarette use had been so drastically reduced in recent years, we incorporated that. At the same time, the model was flexible enough to consider variations in these initiation rates. So anyway, we ran the model. Here are the results you see. And what we show here is drastic reductions in menthol use, some of that switching over to non-menthol smokers, and then also increased e-cigarette use. Oops, sorry. So here you see graphically the kind of trends we had. Again, drastic reductions in menthol use, increases in non-menthol use, not as big proportionately because non-menthol smokers began at higher rates. And here it gives you an idea of the overall effects on cigarette use. And we did find that there were what might be considered substantial reductions in cigarette use, which we then translated to reductions in both cigarette and e-cigarette avertible deaths. We then did our sensitivity analysis. What you see here is that the results were particularly sensitive to the rate of switching from cigarettes to e-cigarettes. That's an important implication of the model because it tells us what's important, what's potentially important, what we need to understand to fully gauge the effects of a menthol ban. Again, I want to emphasize some key points of the model. The model does focus on regular use, and it doesn't distinguish dual and exclusive use. Is that a limitation of the model? That's something debatable. We didn't consider variations across subpopulations, as David Mendez suggested. There are potentially important differences between the African American and rest of the population because of the high rates of menthol use in the African American population. Again, as I've tried to continually warn, the results depend on the stability of transitions. Will the recent reductions in smoking continue into the future? Who knows? We'll have to wait and see. And that's one of the reasons we did such extensive sensitivity analysis. And then finally, we kind of did away with the results on smokeless tobacco. Not to say that they aren't important, but at this point, we went to try to simplify the model as much as possible and to get at the issues with the potential of bringing in smokeless and potentially oral tobacco products and heated tobacco products later on. So in conclusion, we did find substantial improvements in public health through reduced smoking as a result of a menthol ban. We did see major reductions in smoking attributable deaths, to some extent offset by the increase in e-cigarette use. Our results were sensitive to parameters, especially switching from cigarettes to cigarettes. And what I want to emphasize again is we're trying to develop a simplified model. And as part of our T-Cores, we've made that model available with a 100-page user manual, and we would strongly encourage others to engage in the modeling process. As much as a way of looking at the potential effects of policies, as in thinking about the relevant transitions that we need to focus on in the future if we're really going to understand patterns in tobacco use. On that, thank you. I look forward to our discussions in discussion sections.